The first step in addressing implicit biases is to recognize that we all have them. And there's no shame in that. We all have different lived experiences which shape our worldview. But we have to accept that others have different worldviews. And so it is important that we examine our own biases so that we can address them, both to be better doctors and to be better people. I do think there are some things that we can do to help address our own implicit biases, particularly in the health setting. First, we have to treat people as individuals and not as stereotypes. And there's a little trick you can do if you want to make sure you're not looking at someone as a stereotype. When you see someone, whatever first comes to your mind, you think about that person as the opposite. If you are treating someone who is unhomed, think, how would I behave and how would I treat this person if she were in a mansion? Take the opposite and make sure your answer is no different. Then you know you're addressing those stereotypes. But even more importantly, I think that stereotypes start to crumble when you get to know people as individuals. And this means that you really need to meet people from different backgrounds, different cultures, different orientations, so that you can have a better understanding in a more personal level of what other people's lives, experiences, and worldviews look like and are shaped by. And when you expand your world, some of those implicit biases just start to crumble. As physicians and healthcare providers, we must address our implicit biases so that we can best treat our patients, particularly our marginalized patients from underserved communities. Our patients have so many barriers just to getting to our office, right? Sometimes there are financial barriers, there are time constraints, there are trust issues. Once we get them in front of us, we have to be able to provide compassionate, accurate uh, care and diagnosis and appropriate management so that they can thrive as their counterparts do.